We want to start off with a reminder that we are not doctors. Before you make any changes or try something new, always consult with your doctor and medical team first. Chronic illness can vary from patient to patient, so it's always best to consult with your own doctor for what is best for you.
Hello and welcome to IBD Determined. I'm your host, Mason Harvey, and I speak from the role of a patient, and I have Crohn's disease.
And I'm your other host, Michelle Harvey. I'm Mason's mom, and I speak in the role of a parent and caregiver on this podcast. And today's episode is going to be focusing on a topic that has been spoken about a lot.
Entirely.
Yeah, and we've mentioned them, but we wanted to dedicate a whole episode to this because it's pretty important. And it is about biosimilars.
Yay.
So
the insurance loves.
Yeah, and insurance does. They're a fan.
Yeah.
And most of you out there, patients and caregivers like myself, we are not necessarily convinced that this is the way to go.
Mm-hmm.
So it's important to talk about, though, because I think it's something we're all going to encounter at some point.
Mm-hmm.
So it's concerning for us because when you're on something that works, like you're on 2 biologics.
Yeah,
so,
I'm on 2 biologics.
So you're on 2 biologics. And so right now, everything is working really well.
Mm-hmm.
And so for us to be notified, we have to switch over to something else.
That would be stressful because you don't know. It's a biosimilar. It's not going to be the exact thing. So you're not sure. It's a similar. It's not an exact.
Right.
You don't know if it's going to work as efficiently or if it's going to work at all.
And
it should work, but
right.
You never know.
Because the thing with biologics is they are crucial to keeping you guys in remission.
Mm-hmm.
And so when everything's going smoothly, you don't want to switch it up. And so it's not to say that it may not work, but you don't want to
but you don't want to risk it. You don't want to risk it.
Yeah.
If you're feeling healthy after you just came out of flare, you don't want to be like, oh, well, I'm going to go try this other random biosimilar.
Now, it might be different if you have never taken one before and they put you straight onto a biosimilar, then, that would be the first thing you try. And it might work for you. Yeah. And so that would be a little different. But I think most of our concerns do come out of the unknown and not knowing if something's going to work.
Mm-hmm.
And so, and so we're talking about biosimilars, which are compared to biologics because we're not going to be talking about anything like JAK inhibitors because those are not biologics.
No, they're not.
So they're going to have exact copies.
That's pretty nice.
Yeah, because it's a different formula, essentially. So we're going to kind of jump into this. It's going to be a lot of information. We'll leave links for you guys. So that way you can access any of the stuff we've talked about. You can look it up, do more research, do more reading. I try to keep it limited. So Mason didn't fall asleep. All of you guys don't fall asleep
either.
Nope, I don't. Otherwise, it's really boring. We can edit that out. So yeah.
The beauty of editing.
Yeah, exactly. Exactly. So we're going to start off with referencing the Crohn's and Colitis Foundation.
And if you have anything to ask about IBD, go to the Crohn's and Colitis Foundation and they have you.
Yeah, they have everything.
Yep.
So they also have biosimilar information and they have several pages on it with several resources. Like I said, I'll leave a link and you guys can kind of do a deep dive into that because there's a lot of helpful information, both for patients and providers as well. So according to the Crohn's and Colitis Foundation, biosimilars are biological therapies that are proteins that have been made to target part of the immune system. So far similar.
Yeah.
In the name.
So
similar.
Far similar, yeah.
Biosimilars are designed to be a similar, near identical copy of all other already approved biological therapies, also known as, so when you hear us talking about this, we may refer to the original biologic as the reference product or the originator biologic. So that's what they're comparing to. So they are supposed to be drugs that act just like the originator product, having the same effectiveness and safety in the patient population that it treats. So that is, according to Crohn's and Colitis Foundation, what a biosimilar is.
Yeah. I feel
And
like in a perfect world, that might be what it does.
right. So biosimilars are also going to be taken in the same form as the originator product. So if you got an injection, you'll
It's
get an
still going to be an
injection.
injection.
If you had an IV, it'll be an IV.
Yes.
So
It's not going to change.
yeah, so it'll be the same way. And the FDA has approved biosimilars for the treatment of IBD, which includes Crohn's disease and ulcerative
Mhm.
colitis, which is why some of you listening may have heard of these. And so according to I looked at fightcancer.org to just do a quick recap for you guys on biologics, but we have a whole episode we dedicated to biologics,
Yes.
and you're welcome to catch that.
That out if you want.
Yeah, check that out. And
To that in the description.
yes. And just a quick recap though is biologics are made by reproducing or growing copies of a specially engineered living cell. Okay. So the key thing here is a living cell.
Life.
And so this process begins by growing cells in a carefully controlled facility. So that's how a biologic is
Made.
born. Yeah,
Born,
made.
created, whatever.
Right. So a biosimilar has to be considered, as in the name, highly similar to the referenced product. So it has to be as safe, pure, and potent as the reference product, which again is the biologic in our case we're referencing, for the conditions for which it was intended to be used. It will also be proven through a series of tests and trials. So
It's important.
that's kind of what a biosimilar will go through to make sure that it is close to a biologic as it can be. So the next thing is these biosimilars have to get approved by the FDA, just like biologics do. Yeah, very important.
Yeah, they always ask like it. You can just put it in now.
Yeah. And
you have to check it out.
So in order to be approved as a biosimilar for the FDA, the product will have to have the same mechanism of action, so how it works in the body, and like we just discussed, be administered the same way, like injection or infusion. It has to have an approved dosage form, like an example would be like liquid, how that's taken. And strength as its reference product has to have the same strength. Okay. So those things all have to have the same mechanisms in all of them. And the reference product and the biosimilar may have certain minor differences, which could include differences in the clinically inactive components of the drug. But again, we found all this information and put it all together for you guys so you didn't have to. And
so you
can just kind of listen to this. And so just as with the reference product, the FDA pays special attention to the manufacturing process for the biosimilar. Slight variations will be expected. However, the FDA requires that these variations can be carefully controlled, monitored, and kept within acceptable limits. So, yeah, you're supposed to have it down to the same manufacturing, but obviously they do know things might be a little different because it's not the same plant.
Yeah, it's not going to be the same thing exactly.
Right.
It has to be pretty similar though. If it's
right.
Called that.
So that's another. So these are all things. I don't know if people realize the process and what it takes. So hopefully this is either making you feel better or
you're like,
because for me it's not about making myself feel better about this. I guess it's more about having education, understanding it. So if the doctor does present this to me, I will have some knowledge on it
and insight into it.
Yeah. And the last thing I want to say on that is the FDA requires that the patient have the same clinical response, the biosimilar, as the original biologic. So the same clinical response. So you should technically respond
the same way.
That is required by the FDA to get it approved. So it's supposed to have had the same clinical response as the current one you're on. If
Hopefully it does.
Yeah. So that's interesting too. But again, we all know certain biologics, sometimes people will still flare when they're on their same biologic, and sometimes they have different responses. And that's something to go into that. We could do a whole other thing, but from my readings with biologics, because they're made from live cells, no two biologic treatments will ever be identical.
No, you can't, because it's a living thing.
Right.
You can't just, it's not like it's a 3D printer, it's not saying that a biologic is, but it's not like you can replicate it and start printing it out. No, they have to be created, born, it's a whole never going to be exactly the same.
So it's interesting that even a biologic compared to itself may have differences. So they're gonna have the same process, but there could be slight variations. So anyways, that's like a whole nother episode. That was something I found in the readings while I was researching for this. That was like a whole other rabbit hole I was ready to jump down, but We're going to stay focused today. So, why, and most of you out there, you already know the answer to this, and but we're going to answer this question anyway. So, why were biosimilars developed?
Because to save money.
Obviously, people want to say, well, to save lives. Yes.
Yeah.
But it was also to save money because there wasn't enough competition when you only have one drug that is available, like Stelara.
Yes.
Or Entyvio, and there's only one like it, and you can't get another one, that drives the cost up, and that's a
creates
problem.
a monopoly.
It does. And so they want competition. And so they it's encouraged for these other companies to go out there and start creating things to create this competition and drive costs down.
Because if Stelara is the only company out there that has no biosimilar, they have a biosimilar. But if they didn't, they could say, well, we're the only one like this, so we're going to drive the prices up, 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 up. Right. And now there's a biosimilar, people can be like, right, well, we're just going to go to this then because we don't feel like paying all that for just this. And that's what insurance does. Mm-hmm. So insurance says, hey, well, now this is available, and because it's FDA approved and it's a biosimilar, we can do this. So we'll get more into that a little bit later. So just to give you like an example of, how they are, why, because it's like, well, yeah, they drives the cost down, but why are biosimilars cheaper than a biologic? If they're supposed to be so similar, then how come a real biologic, well, they're both real, but the true biologic is much more expensive than the biosimilar? And I am happy to answer that question. Yay, we have an answer for it. Yes. So I went to Pfizer for this is one of this was on many sites I found, but I used theirs because they had a nice chart, which made it easier. And so they provide an example. So say you have an original biologic that cost $2.6 billion to develop. Okay. That's about, this is like a realistic situation. Okay. $2.6 billion. That's a lot. A biosimilar costs around $100 million to develop. So it's still a lot of money, but it saves less. A lot. Yeah. Yes. So they're already jumping in because that research and development that went into the first biologic has already kind of happened. Done, yeah. And they don't need to do as much research. Right. Like, because that's it's already been created. So they know the foundation. So they still have to do their own research to create their own, but they can skip a lot of steps because that other copy already exists. It's already been. Yeah. And so like, as far as time wise, a biologic can take upwards of 10 years to create and develop, whereas a biosimilar can range from 5 to 9 years. So you have a lot less time also so much faster into it. So it's faster and it costs less. So that's where they can come in and they can start off and charge less money. So that's kind of the nice. That's kind of the situation with that. And one of the questions a lot of you might be asking is how can a biosimilar legally copy? Yeah, how can you copy another company? Right, because if this other company had to spend $2.5 billion to create this, how can this other company come along and just copy it? The big company just spends years and tons of money. Yeah. And they finally find something that works. I'm like, oh my God, I finally found something that works. It's a good biologic. It works. It's doing stuff. So how is that fair? And so, I mean, most of you listening are familiar with patents, right? So you get a patent for an original product and you own the rights to that. And people cannot just go around copying it. No. And doing stuff like that. That's thankfully not correct. But there's also something with a patent expiration. So typically for a biologic, they will receive a 20-year patent. So for 20 years, they've got control. After that, 20 years. Yes. After that, it becomes fair game. Which isn't that like with music? If like copyrights on music. So the copyright on music, it's like the song will be copyrighted, but 70 years after the creator of it dies, isn't that correct? There's something like that, yeah. Then anyone can use it. I think that's what happened with Mickey Mouse, Steamboat Willie. With Steamboat Willie, because it just became available to the public. And because I think that had been was that like 100 years? I don't. Might have been. It might be different for the music, right. And then you have the cartoon. This is you guys listening, probably, but I mean, I'm familiar with what you're saying. We're talking about biologics, not music, so right. Not really. Same thing. There is a time frame, and certain things it expires after a certain amount of time, so it can become free to anybody for different reasons for you to try to go after. And so for a biologic, you get basically 20 years with your patent.
And that's not dependent though, so on FDA approval. So, because I wanted to explain this because this was something I was thinking. I'm like, well, so when it gets FDA approved, do they start the countdown from there? So, according to the FDA, patents can be issued or expire at any time, regardless of the drug's approval status. So, I'm going to give you an example really quick so you know what I'm talking about. And I'm going to use Humira because Humira is an IBD drug. So, some of you out there might be taking it. So, the example with this is so the FDA approved, and it was FDA approved. Humira was in 2002.
Wow.
But the patent expiration date for Humira was in 2016.
Oh.
Because the patent process happened before the FDA
approval. Oh, okay.
Yeah. So
before it's even able to be used, it still is.
So you have to get that patent process going to even get the FDA approval. Okay. So even though Humira was approved in 2002, it expired, the patent expired in 2016. And
interesting. Instead of 2022.
Right. So that's interesting, right? Mm-hmm. So I was thinking on it and I found something called an ancillary product patent. And we're going to use the example of Humira because Humira was involved in a lawsuit regarding this. And
that's great.
Yeah. And well, I mean, them and several others because Congress is trying to go after them. And you'll see why. So they're sneaky. Okay. So if you invest all that money into a patent and into a product, into creating it, and you're making a lot of money, you don't want to let that go. No. Right? It's like, I want more than 20 years.
I want that.
Right? I don't want to give that up to somebody else. So that's where this comes into play here. So I'm not going to go too into depth. I'm going to try to keep it very simple, just kind of brief, but you guys can look this up once you've heard about it. So drug makers will withhold critical information from the U.S. Patent and Trade Office. So that's the USPTO. That's what I'll refer to it. And they extend patents on approved biologics by doing this. So, and the reason is because the USPTO and the FDA, they aren't in sync on this. So you would think they are working together,
but they're not.
But they're not. And so there's this little hiccup. And that's why Congress is going after this because they want them to work together on this to create more competition in the market. They don't want someone to dominate and keep
the market. Yeah.
Right. So this is the issue. And so here's how the little loophole works. So the FDA possesses ancillary product information, but it maintains it as a trade secret. Okay. So so that information is not disclosed to the USPTO when you apply for a patent. So even though you're supposed to disclose everything, there's certain things that are called trade secrets that the FDA holds on to for them and doesn't tell the USPTO.
Hide them.
So by keeping this information confidential, biologic manufacturers make it more difficult for competitors to access information needed to develop biosimilars. So when one patent expires, they have these other little secrets that were not included with the original patent. So
they have them put another patent on.
It's like, so they have a secondary patent going on, essentially.
So now that would be instead of 20 years, that would be.
And you're going to see what happened.
Okay.
So this is cool, right? I thought this was very, very informative because this was something I didn't realize. This is kind of, I mean, we're still talking about biosimilars and stuff, but
it's getting entertaining.
Yeah, but it's kind of just a background because I thought it was worth knowing. So ancillary products are critical features of the active ingredient that allow it to act on its therapeutic target. That could be glycan profiles, oxidation levels, or other physiochemical properties. So rather than filing ancillary product patents as part of their initial primary patent filing, manufacturers keep these ancillary product features confidential as trade secrets, and they wait years before obtaining ancillary product patents. So
sneaky,
right? That's how they play the game. And so this strategy allows biologic manufacturers to extend periods of market exclusivity because later filled ancillary patents typically expire after the primary patent. So it's like a built-in way to like here, we gave you part of the answers.
Nail it.
But we didn't give you this.
And so now you can't do it.
You can't create a biosimilar. Even though the patent has expired, you don't have all the answers because they hid it as a trade secret with the FDA. So I'm going to continue with Humira because we were on this topic. So let's talk about Humira. So like I said, It was first approved in 2002 by the FDA. USPTO gave it a patent expiration date of 2016.
Okay.
But AbbVie, who is the owner, they make Humira, they filed 15 ancillary product patents that extended that date to 2034.
Wow.
So that granted them an additional, they broke it down to days, 6,527 days of exclusivity. So
that's really smart. But,
right.
I mean, it's smart, but at the same time,
Right.
it's
So it's interesting, right? Because it's interesting how all this works. And so that's why there are some things being tied up right now with certain companies and certain biologics where they're like saying, you can't do that. Like, no, you got the patent, but you can't hide that as a trade secret. That is part of developing it.
I feel like eventually, if it gets too bad with that, they're going to have to make the first patent from like 20 years to a short amount of time because they know someone's going to do that.
Well, they're right. They're gonna have to do something eventually because
if you keep having secrets on stuff, you could just keep prolonging it forever, basically.
And then nobody can, it creates a monopoly.
Yeah, and that's a monopoly, yeah.
Right. And so as much as I love just like having the original and be like saying, hey, I don't really want them coming up with a biosimilar information with this yet because I don't want that to get him to get put on that. But at the same time, what if the biosimilar did great for you? It saves insurance a ton of money. It saves us money. Maybe it's not a bad thing. So
now they're listening to this. They're like, oh, well, we have to keep more secrets.
yeah. So it's kind of like, it's just kind of interesting because I have like, when I started researching this, I had like this aversion to biosimilars because it was like right away I felt like, because I don't like what I felt like when insurance gets pushy and says you have to do this. I don't like that. Now, if Mason's stops working and they want to switch to something else, then that makes more sense.
That makes more sense. But if something is working, why change it?
Right. Especially because it's a biosimilar. And the interesting thing is we had been to a conference with the Rady Children's Hospital on IBD, everything IBD. And we covered that in some of our past podcasts, by the way. Lots of good information there you guys should be checking out. But one of the things that was interesting is, first of all, our GIs at Rady Children's, they prefer to, keep you on what you're already prescribed. They're not going to want to seek
they don't
out.
want to change it.
Yeah, they're not going to want to try to, right. They're not going to want to rock the boat. And so, but if they cannot, like if they appeal it and cannot fight it because insurance will just not cover it, then they will follow closely and fight to get you onto what you need. So they're not just going to sit back and say, okay, well, this is it. They will fight and follow closely to make sure that it's working for you. So there is that.
Good.
And one of the things that was interesting is one of the doctors had said that there have been instances where the biosimilar actually worked better than the biologic. And so I'm assuming like that would be for somebody like maybe when you were on Remicade and it wasn't working for you. And so maybe if you took the biosimilar,
it might have worked.
I mean, I don't think it really didn't work for you.
I don't think it would have worked.
Yeah.
Because it didn't do anything at all.
Yeah, I know. It wasn't a great situation for you. But maybe if you're taking something that is working, but not totally, so sometimes that does happen. It's just unfortunate because nobody wants to find out that it's the opposite way. I mean, that's a good situation. So our doctors do fight to keep them on the original biologic at whenever possible.
I feel like if a biosimilar came out for Entyvio, like what I have, I would definitely want to stay on it. I still don't really like biosimilars. If I don't have to be on it, I won't want to be on it. As long as this is working, I definitely don't want to be on a biosimilar. But I will say the one thing that is good about a biosimilar is when it does come out, even though I'm still on this, the plus is the price is going to go down. So
exactly.
There's still good to them.
There is. And so that does make sense.
The only downside is insurance can say, well, go on this.
Right. And maybe, I don't know how it all works because this is not my field of study, but and so the last thing I want to talk about is the Crohn's and Colitis Foundation, their stance on biosimilars and what they feel. So there's a few points that they made that I really want to make sure I include for you guys. Okay. So this is their stance on it. So FDA approved biosimilars are safe and effective for patients. That's what they've determined. So again, that's not our statement. That's That's
That's
Clinical
theirs.
Foundation. The foundation supports the FDA in its role in ensuring the safety of patients, and we support ongoing research in both the adult and pediatric patient populations. So the next thing that they say, health plans that change their coverage or share of cost to incentivize patients to switch to a biosimilar or who otherwise mandate such a switch should provide timely notifications that include disease and drug specific education to the patient and the prescriber. So there's adequate opportunity for the patient and medical professional to discuss the change, which is fair, right? Like, fair. So instead of like insurance just suddenly sending over, like, say you're expecting Stellaire and you receive something else in the mail, that
shouldn't be able to happen.
Right. They should first of all discuss everything. Everything should be discussed between you and the doctor first.
That's definitely fair.
Right. And that's how it should be. And then when notifying a patient of a switch, communication should include information specific to the product, like the cost to the patient of the new medication, if it's citrate free, because that's important. Most are becoming citrate free. A description of how the new medication is
hopefully it's
administered.
still the same way.
Right. Because, and it should be, right? But you want to make sure. And as well as training for any new device, because some of these, if there's a different way to administer it. Like I think it's like Skyrizi has a different apparatus to inject. It's kind of interesting. And the last thing that the Crohn's Colitis Foundation said about them is switches to biosimilars should not result in any additional out-of-pocket expenses for patients and should not be subject to utilization management protocols, which create barriers to a timely medication access. So like not delaying your treatment, right?
No.
And making sure that it's not going to cost you more out of pocket. Like it may cost, maybe like say it's a better deal for insurance, but not a better deal for you.
Yeah, that would, you still keep it the same. And
patients who utilize biosimilars should have full benefit of any copay assistance provided to them. So like this is like, that's important. And I'm glad the foundation brought that up, because in a lot of cases, we have a copay assistance. So like for Mason, our insurance pays like for his say for Stellaire. And there's like a $2,000 difference that our insurance doesn't cover. That is on us to pay.
Yeah.
And $2,000 every 4 weeks for us would be
quite a bit.
Quite a bit, especially considering he's on a second one every.
Wow. Because that's like 4,000 or who knows more.
And so that would be very difficult. But they have a copay assistance program where you only they will give you like a credit card essentially that covers the difference. So where
every year
they give you a certain amount per year. Yeah. And so that will cover like that $2,000 will be covered, but you pay like a $5 copay. So you just want to make sure with the new biosimilars, like your insurance isn't leaving you with like a $2,000 thing, and they don't have a copay program. And
that wouldn't be good.
That would be terrible, because
even though it's cheaper, you're still not
right. You wouldn't be able to do it.
Still losing.
So important things to know. And I mean, obviously, I think it's going to make more sense than that, but that's just like a scenario, like worst case kind of thing to talk about. But that's why it's important for disclosure and to discuss these things with your doctor before you switch, so you know what you're getting into. So how do you
switch? Remember to get a second opinion with your doctor.
Yes.
That was important.
Yes, which we always are advocates of. And
ask your doctor, get a second opinion, do whatever.
So after learning all that, how do you feel? Like, I mean, you've kind of already said it, but
I feel like I went into this not liking a biosimilar at all and never wanting to be on one. But after hearing this, I don't hate them as much, and I'm thankful that they exist for help if someone else needs it.
Yeah.
And to drive down prices, and so it's not a monopoly. And I would consider being on one if mine stopped working.
Right. Not like you're like volunteering to jump.
I'm not going to say I'm going to try the biosimilar before I try the real one. No, I'm going to try the real one first, always. Yeah. But if that doesn't work, I would try biosimilar.
Makes sense. I think that's fair. And I think that's kind of where I'm at with it.
Give the company with the credit the first try.
Right. And I think that like for you, if we hadn't tried something, they want to put you on the biosimilar first, I might not be opposed to it because we haven't used it. But yes, I would be very much opposed. I will tell you this, if we got notification for Mason, I would definitely fight it at this point to keep him on what he's on, because it is so hard to get into remission or any kind, like there's so many levels of remission, which is another podcast of ours. But it's so difficult to get there that I would not want to risk removing him
and
from
trying
it.
something else.
And so for me, it's like I just want to keep it status quo, keep it as is, and keep moving forward. And if something changes, then we go from there. But yeah, right now I'm more confident in them. I think
definitely.
hearing the process they go through, but I'm also still kind of feeling the same as I was. But it was interesting to learn about the patent process and all that too. So what they go through. So anyways, as always too, some of you out there might be more experts in this than us. And we were just looking up.
We're looking at sources.
Right. To give you guys kind of compile everything and put it into one place so you guys can maybe have something different to consider, to think about, or to ask your doctor. Maybe this will prompt you to think of something that you want to ask your doctor about and say, I hadn't thought about that yet. So, yeah. So with that, guys, that's going to be the end of this episode. Yeah.
Hopefully it wasn't too boring. Hopefully you were entertained.
I know, because it was a lot to actually research for this one. It was a lot of work. And but I was so excited with some of the things I found, like the information. It was like, wow, this is really, so it was kind of very informative to me. And I hope it was like that for you guys too, where it's kind of interesting. And we'll, again, include the links so you guys can do your own research, your own reading, and always discuss with your doctor before saying, hey, we heard on IB determined that blah, blah, blah. No, go to your doctor first and trust your doctor first, always. So
here's the podcast channel.
Yeah. And so you guys are welcome to follow us on Instagram at Team IB Determined.
Yes.
And the Reggie Project. We're gonna do another show on the Reggie Project.
Yeah, we want to talk about it.
Yeah, like a second launch of it, because I really want to get that moving. And especially if we do end up on a road trip and take Reggie with us, I want you guys to follow along and kind of participate too. So I think we'll have to do another podcast on that and just kind of remind everybody.
Talk everyone about it.
Yeah, you guys can listen to us. If you just want to listen, you can have options like Spotify, iHeartRadio, Apple Music, and Apple Podcasts. And a
lot more, which will be linked to Buzzsprout.
Yep. And so show all your listening options. And for those of you who want to watch,
we have YouTube, which also has a podcast. But if you just want to watch us and hear us, you can go to the YouTube videos.
Yeah.
And if you are watching us on YouTube, make sure to like and subscribe. And if you want to be notified every time we post a new video, make sure to hit that bell icon. And we love getting your comments. So please give us a comment if you want to. Just say how you found our channel, what you related to, what you thought about our episode, what you just want to say hello, or
if
something
there's something you'd like us to research and
you want us to talk about in the next episode or something we missed, you can talk all about that. We love getting your comments and we read every single one of them. Just remember to stay positive and kind.
Yes. Most important thing, guys. Yes. That's a great message for anybody. Positivity. Yep. Important to remember. So yeah, we just got our word Karmatude. Speaking of patents, we went through the.
Oh yeah, we actually did.
I'm at those in the very end, but we went through the USPTO. We went through that whole process and trademarked the word Karmatude. And kind of like Mason was saying, you put out, what you would like to receive back, not with expectations, but just be the person you'd like others to be.
Because at the end of the day, you can feel good about being kind.
Yeah, and being that person, you at least feel good about yourself and say, hey, I did the right thing. Can't control others, the end of the day. But to keep spreading that message of positivity, kindness, and stay strong out there, guys. Hope everyone's doing well.
Good every day.
And have a good rest of the week.
Good rest of your week, day, weekend, whatever's going on. I don't know.
Yeah. And we'll see you guys
in the next
episode in 2 weeks.
2 weeks. Yes.
All right, guys.
Bye.
Bye.
We hope you will stick around, tune in, and reach out to us with your own journeys. We are excited to give you an inside view of what it takes to be a caregiver and what it's like to be a patient.
And most of all, we hope you'll maybe be able to apply something you hear on here that might help you in your own life. Sometimes life changes, and it's all about how you handle the journey.